Hello, my name's Jerry Newman. I'm a learning disabilities liaison nurse and I work in the East Ipswich and East Suffolk area. I wanted to use this opportunity to talk a little bit about the work that the learning disability liaison nurses have been doing with ACE advocacy. When I first started my job as a liaison nurse about 2 years ago, it was immediately clear that we were working closely as a team with ACE advocacy around making easy read and accessible information. It was ACE who were actually producing the information, ACE advocacy, but we were supporting them and helping where we could by identifying really important subjects to cover and feeding into the process itself. So this relationship between the learning disabilities liaison nurse and ACE advocacy has really grown over the last couple of years. It's moved on from simply making accessible information to a lot of work together, a lot of co-production work. We go to events together to talk about people with learning disabilities, the importance of attending annual health checks. And what ACE advocacy have been able to do is collect a huge amount of information about the experiences that people with learning disabilities have with GP surgeries and around annual health checks. ACE advocacy have supported the development of a team of peer educators. So these are people with learning disabilities who are trained and supported to talk to other people with learning disabilities about the importance of attending annual health checks. And this has been an incredibly successful piece of work, and it's provided a huge amount of feedback that we as primary liaison nurses can take back and work on, and therefore hopefully improve the services. Since the COVID pandemic, our work's changed quite a lot, as has that of ACE advocacy. A lot of our work now is being done online, using information technology to keep in touch with people, to have meetings, to have conversations, to talk to doctors and nurses and patients. And we've been meeting a lot with ACE advocacy and the peer educators using the Zoom team meetings, either to have proper team meetings or once a week on a Wednesday we meet with the peer educators, and it gives everybody the chance to talk about any health concerns they might have, any worries they might have, any problems they might have contacting doctors or nurses. And it also gives us a chance to explain how things are being done slightly differently now.
The liaison nurses have been really supportive with feedback and info.
They help you if you have any questions to do with the doctors, and if you've got any questions for the doctors about health and related issues and things like that.
Some people have been sent confusing information about COVID, and they've helped make sense of it.
It's quite useful because I don't often get to speak to a doctor. So it's a good chance. It's a nice chance to speak to a doctor about anything that I've got issues on or anything I want to know.
And being able to do that face to face using this kind of technology has been really, really important. It's kept all of us in touch, has really helped us do our jobs. We've got a lot more work planned in the future. We'll obviously carry on with our Wednesday peer educator meetings. We'll also carry on making plans with ACE advocacy. I think we've all got some really, really exciting ideas. An example of which is we want to start working on creating learning disability friendly GP practices. and enable GP practices to work towards an award. It'll be a really, really important piece of work. We're looking forward to working closely with the peer educators and with ACE advocacy around this. But that's just an example of the kind of things that we'd like to do in the future. I would imagine for the time being, all this work will be done using this kind of technology. But it's helping us move things forward and helping us improve services, and that really is what the relationship between the learning disability liaison nurses, ACE advocacy and the peer educators is all about. Okay, thank you then. Goodbye.